Good morning. I will present hepatitis A, B, and C. Hepatitis A. It is the inflammation, irritation, and swelling of the liver by the hepatitis A virus. The virus occurs approximately 15 to 45 days before symptoms appear. It is the lowest type of hepatitis. How is hepatitis A spread? Eat or drink foods that have been contaminated by feces that contain the hepatitis A virus, unpeeled fruits, vegetables, and raw seafood. If you have contact with blood or feces with an infected person. If you have sex that involves oral or anal contact. Not all infected people have symptoms, that is, there are more people infected than reported. Hepatitis A symptoms: dark urine, fatigue, itch, abdominal pain, loss of appetite, nausea and vomiting, low fever, pale colored stools, yellow skin. Symptoms usually appear 2 to 6 weeks after being exposed to the virus. It can last for several months, especially in adults. Why is hepatitis A considered an STD? It is considered a sexually transmitted disease since if a healthy person has oral or anal contact with someone who does have hepatitis A, they will automatically become infected. Hepatitis B. Hepatitis B is an infection of the liver caused by an virus called the hepatitis B virus or HBV. It is serious and has no cure, but the good thing is that it's easy to prevent. It is very contagious. How hepatitis B spread? It is transmitted by contact with semen, vaginal secretion, blood, and urine. Hepatitis B is not spread by contact or by saliva. Having vaginal, anal, or oral sex, sharing toothbrushes and razors, remaining blood may be infected. Sharing needles to get high, getting body piercing or tattoos, being punctured with a needle with blood infected with the hepatitis B virus. If the baby in the childbirth can be spread. Hepatitis B symptoms: joint and abdominal pain, dark urine, fever, loss of appetite, nausea and vomiting, weakness and fatigue, yellow pigmentation of the skin and whites of the eye. Some people do not experience any symptoms. In chronic cases, liver failure or cancer can occur. Why is hepatitis B considered an STD? Hepatitis B is an STD because it is transmitted by contact with semen, vaginal secretions. In other words, when you have sex with someone who has hepatitis B, you will automatically catch it. However, the use of condoms or a latex mode barrier helps prevent it. Hepatitis C. Hepatitis C is a liver disease caused by the virus of the same name, HCV. The virus can cause acute or chronic hepatitis, the severity of which varies between a mild illness that lasts a few weeks and serious illness for life. How is hepatitis C spread? The hepatitis C virus is transmitted through the blood. It is not transmitted through breast milk, food, or water, or by occasional contact. Injection drugs use and sharing injection material, improper reuse or sterilization of medical supplies, especially syringes and needles in healthcare settings, transfusion of blood and blood products without analysis, sexual practices that involve exposure to blood, Hepatitis C symptoms: dark yellow urine, fatigue and fever, gray or clay colored stools, joint pain, loss and appetite, nausea and or vomiting, abdominal pain, yellow pigmentation of the skin and whites of the age. Most people with hepatitis C have no symptoms. Some people with acute hepatitis C have symptoms 1 to 3 months after being exposed to the virus. Why is hepatitis C considered an STD? Hepatitis C is considered because when you perform a sexual act and there is blood involved with a person who has the infection, you will become infected. Reference. Thanks.